Welcome to High Tea with Grace, where we spill the tea on HIT. I'm thrilled to be here at the HIMSS conference, interviewing the industry's greatest leaders about trends in the space. So tell me, who are you and what do you do?
So I'm Nick Sterling. I'm CMIO at Vital Software. I'm an doc by training, and I do a lot of R&D for Vital Software and their quality work as well.
Awesome. So, what is Vital?
So Vital is a patient experience platform. So we basically talk to patients using AI. We help them navigate the health system. Basically, get them where they need to go when they're going through the ER. We tell them what to expect and get them the follow-up that they need.
Awesome. Now, what trends are you hearing in the HIMSS hallways?
I think the patient is sort of reemerging at the center of healthcare. A lot of AI in the past has been geared more towards like operations, but it's good to hear like patient reemerging towards the center.
I'm very interested about health equity at the show and hearing about how it's impacting other folks and what they're seeing in the space. So, what is one of the largest health equity challenges in your mind?
I specialize in AI, so the first thing that comes to mind is probably bias. So your training data really matters. We actually recently just launched a cohort initiative called the Patient AI that defines basically what are the industry standards for the minimum safeguards you need to be able to talk to patients safely using AI. One of the things that we specified in the guidelines that we produced is model training and bias, so like bias assessment. So like what types of data were used to train the model, what sorts of geographic region. In other words, like can you take a patient population and generalize it to other geographic regions and other patient populations and subpopulations. So that's the first thing that comes to mind.
Yeah, absolutely. Such a serious issue and very underrated. It's awesome that you guys are working on that.
For sure.
So now a lot of young people are here at HIMSS and they're looking to get into health IT. If you could give your younger self a piece of advice looking back, what would you tell him?
So the path that I took is I was a software developer at first. I went to med school. I couldn't shake like the builder, like software developer kind of thing. So I ended up doing a long path that I, plus or minus, maybe didn't need to do, but and then I ended up training through residency. Think of how is to do it again. I would say it's okay to just build. Like, don't be afraid to take chances. Um, you never know like what type of skill set you're building now that you can use in the future potentially. So I think that's important to keep in mind. For people who are looking to get into health IT specifically, it depends on probably the angle. Um, I would say to understand the basic principles of data science, like they're always going to be the same. So like if you're looking to build AI systems, for example, um, a foundation in biostats will help because you'll be able to understand like the things that can go wrong in database systems, like bias, like what we're just talking about, generalizability, false positives, false negatives, issues with training sets. So like building that foundation, I think is really important. You can actually accomplish that through a lot of different disciplines.
Awesome, great advice. So good to talk with you today. Good luck at HIMSS.
Well, thanks, appreciate it.